Hello, my name is Anna Woods, and I'll be doing my presentation on cleft lip and cleft palate communicative disorders. What is a cleft lip and palate? A cleft lip or palate happens when the structures that form the upper lip or palate fail to join when a baby is developing in the womb. Types of cleft lip and palate. Cleft lip, separation of the sides of the upper lip, often includes the bones of the upper jaw or gum. Cleft palate is an opening in the roof of the mouth which the two sides of the palate do not join, also known as hard palate and soft palate. Submucous cleft palate. Oral structures look intact, but underlying velar musculature has failed to attach. Posterior nasal spine always missing. Speech problems are common. Cleft lip and palate risk factors: articulation errors, frequent ear infection, hearing loss, feeding problems, airway obstruction, dental abnormalities, effects of speech and language. Babbling may be delayed. Babbling tends to consist of nasal sounds and vowels before surgical repair. Difficulty in normal speech production, errors in speech sound production, abnormal nasal resonance and airflow. What speech problems might children with cleft lip and palate have? Speech sound development, velopharyngeal incompetence, and hearing loss. What can be done about speech problems related to cleft lip and palate? Speech therapy, speech surgery, get regular ear and hearing exams. Help children with cleft lip and palate develop good speech. Work on speech tasks such as blowing whistles or bubbles. Encourage children to talk to you using his or her best speech. Talk to children and encourage language learning opportunities. Work. Child speech therapists to get home activities that are directly related to his or her therapy plan. Do activity handouts given to your child from the speech therapist to work at home. Here are the references, and that includes my presentation. Thank you.